Matthew Holt with the Healthcare Blog and on the TXCB Spotlight, and I have Tatiana Fofanova here. She is with Koda Health, who are in the business of helping advanced directives and end-of-life decisions get from patients to clinicians and others in the healthcare system. So, Tatiana, welcome. So this is an area that people have been talking about for a long time. There's been the post regulations, I think, in the various states about end of life care. I was involved with Alex Strain's Engage with Grace, getting people to talk about this. There was five wishes from Robert Johnson all those years, but it's still a mess, understandably, mostly because people don't know where to start, getting advanced directives, and have real problems communicating them to their doctors and their healthcare providers. So what is your answer to this? What is Koda Health doing?
Yeah, so Health, blah, blah, blah. So Coda Health helps patients plan their care in advance and therefore get the kind of care that they want through serious illness all the way to end of life. And frankly, we actually don't call ourselves an advanced directive company. We call ourselves an advanced care planning company because traditionally this process is navigated through an estate attorney for most folks or through a provider. But unfortunately, estate attorneys are not accessible to everyone in the population. Not everyone has an estate to attorney, and they tend to not have enough clinical knowledge to be able to guide you through some of the other decisions you have to make. I've also never met an ER doc who will call up your lawyer when you roll into the emergency room to see who your medical power of attorney is and all of that, which causes an immense amount of problems for various health systems.
Yeah, the system's
Um,
like calling the accountants now, I understand. And you're
yeah.
can you afford them?
And yeah. And for the providers are really good at navigating many of these discussions, but they don't have the time to play paralegal on the back end. And so there's all of these critical points where there's drop-offs. So our solution to this was Coda Health. So Coda is um, a tech-enabled coordination service that helps patients make and understand their decisions, share those decisions with both loved ones and providers, and actually get access to additional care services like palliative care and hospice down the road by being able to properly share those decisions. So we have a patient-facing web application where it's accessible from anywhere, that is internet connected, nothing to download, where patients are able to learn about and make those decisions. Those populate legal documents like medical powers of attorney, advanced directives, do not resuscitate orders that they can virtually notarize immediately on the platform. And updated copies or live copies are always sent to their loved ones and to their referring physician's electronic medical record.
Brilliant. So, you're going to show it to us, but before we do that, what's the state of play in sort of advanced directives and end of life instructions? How many people have done that, have gone through this? When you get towards, the latter end stages of life amongst the elderly and those, how many people have got these? Do you know? Do you know what the? I mean, you looked at this and decided to get into this market for a reason. I assume it's because there's a lack of penetration here, but what do you know what the numbers are?
Yeah, absolutely. I mean, the status quo is frankly quite abysmal. So less than 7% of patients actually talk to their doctor or have any of these discussions with their physician about advanced care planning. 68% of patients want to die at home, but end up actually dying in the hospital. Um, Overall, even for patients who do have an advanced directive but didn't engage in advanced care planning, their family members have about a 50-50 shot of choosing the quote unquote right treatment, the treatment that their loved one would have chosen for themselves. And then the even worse statistics that I can conjure up are that minoritized populations, so people of color and people of lower socioeconomic status, are about half as likely to engage in this process and complete these plans than their counterparts.
Yes.
So overall, it's
Back
turning
to them
into
not
this.
having an estate to worry about. It doesn't
Exactly, exactly. And so it turns into this, problem of 100 to 200 billion dollars of care being delivered to patients that is unwanted or inappropriate or poorly timed.
Yeah, and this has been a problem. I mean, I've been looking at health service research since 1990, and it was a problem then, and it's a problem now. And it happens to be we're doing this interview on the day that Jimmy Carter is 100. So happy birthday, Mr. President. He's
Absolutely.
been in hospice for like a year and a half or something now, so going on a long time. So we know that I'm sure his end of life is being managed a little bit better than average, but it's certainly a huge issue. And sometimes people last longer in hospice than they do if they're getting treatment, and et cetera, et cetera. All right, why don't you show us what the consumer experience is? So just let's, I mean, I assume this would be done either by the patient themselves or by a loved one or, family member or caregiver or what have you. So just why don't you just dig in and show us how Coda Health works?
Yeah, absolutely. So overall, most of the people who engage with CODA are the patients themselves rather than their loved ones. What we find is that when we are able to intervene early enough or engage patients early enough, which is why we roll out to an entire population and not just the seriously ill, um, patients are actually more likely to complete this if they can advocate for themselves rather than having their caregiver advocate for them. So let's
Yeah.
go to,
And that's not
um,
illogical if I think about it, because while you're pulling this up, because you know, at some point we are all going to die or get sick and die and get to the end of life, and you want to think about it while you're still ready to go, rather than 10 minutes to midnight, as it were.
absolutely. Can you see my screen
Yep.
for David Copperfield?
Indeed,
Hopefully I don't get any impending cease and desist from David Copperfield.
we'll see. He's got enough
We'll
legal of his
s-
own, I understand. But go on.
all right, let's go. So this invitation would be sent to everyone in a health system or payer would be getting an invitation uh, with a pre-created account, or they're able to create their own account. They're able to hop on pretty quickly. And the way CODA works is we guide patients through the advanced care planning process in the same way as a trained palliative care physician might navigate it. So we help contextualize the discussion by diving into a patient's values, collecting information on, what kind of living situation they might be finding themselves in. We dive into how to pick a medical power of attorney and what makes a good one versus a not good one, and dive in later into quality of life scenarios and medical care preferences. So let's explore the first bit just to contextualize it, and we'll hop back over. So collecting some basic information on who you are and what's important to you before you start making pretty grave or important decisions, and also just to train people in how the platform works. So let's say my family and my independence, my career are very important to me. Um, in this situation, I'm living with others, but we can assess other situations that a person might be finding themselves in. And then we start to collect some information where, maybe we have identified this patient as being relatively low risk, but given some of their responses, perhaps that was a miscategorization, and we need to give them an additional level of outreach so that they're able to, complete their plans with better context. So let's just breeze through some of these um, and dive into medical decision maker. So this is really important. Each major section is guided by a number of 1-minute videos. These videos were designed for a older adult audience in mind. They're very engaging and usable. We've designed them with palliative care docs, medical ethicists, patients, family members, all sorts of folks. And I won't play this one. I'll give you an example of a later video. So we'll skip it, but they do a great job of explaining who is a good medical power of attorney, because many people just pick the person maybe they're married to or a sibling, and you want to choose somebody who will advocate for you. And very often, uh, your next of kin or your loved one, your husband or your wife might not feel comfortable with the responsibility of making those choices for you. And so that's a really important consideration. So let's say David is ready to make a choice on who his medical decision maker is today. And it's going to be his white tiger, as opposed to the other tiger. Let's call it the Siberian tiger. I think that's an outdated name. Cyber Tiger. Let's go.
Too late for Siegfried and Roy, or which one it was. Got attacked by his white tiger.
Oh, absolutely. And that's going to be his friend. That's the relationship there. And he's going to give this tiger or this person named Sibber no flexibility. He wants his decisions followed exactly as he has written them out. So let's be sure to share this with Sibber. So and then give us some context into his email address, his phone number, all of that. We're going to skip a few of these sections for the sake of time. You can also choose alternative decision makers, which we highly recommend in case one person is not available or is not able to make those decisions for you. And then we can go into quality of life. Now, this is a really important section because no product, and many have tried, will be able to encompass all the different surgeries, procedures, healthcare situations that a patient might find themselves in. You can't possibly ask everything about every procedure in a document like this. But you can explore various quality of life scenarios that would or would not be acceptable that can guide decision making for the family and for the providers. So again, we're going to skip this particular video. And we're going to say like, all right, for quality of life, it means something different to everyone, whether it's living through anything, no matter the pain, or being comfortable, even if it means not living as long. Maybe it's a balance of the two for this person. And then we explore different scenarios, such as in terms of your ability to communicate. For many patients, not being able to recognize or have meaningful relationships with their family is a deal breaker. They don't want that. But perhaps not being able to make decisions for yourself is not a deal breaker. So let's select a few in the ability to communicate. We also explore mobility. For many patients, mobility is not a major limitation, but for some, they have very strong feelings. So perhaps living in a nursing home is just unacceptable for David. We have some motivational phrases just to get you along the way so it doesn't feel terribly monotonous. And then we go into independence. So for many patients, feeling like their financial burden can be unacceptable, or not being able to control their bodily functions or being in severe pain most of the time. Many of these can be limiting or considered a deal breaker for many patients, and that can guide decision making. So, and then when you are very ill and only have a little while left, where would you want to spend that time? Many of our patients choose home. So let's skip to the next section for the sake of time. Let's jump to medical care. So there are a number of different life support treatments that you can sort of engage with and learn about. Most traditional advanced directives are very simplistic. It reads very, pull the plug or don't pull the plug. I got a news flash for everyone. There is no plug. Usually it's a little bit more complicated than that. So when we jump into these, let's listen to at least one video. This one's a fan favorite for a bunch of folks on CPR.
CPR is an emergency procedure that can be used to try to restart the heart if it stops beating. It uses chest compressions, which are hard, fast pushes on the chest to try to keep the heart pumping. It might also require a machine to deliver an electric shock to the heart to restart it. You might have seen this in movies. A person's heart stops, and immediately the handsome doctor races to the scene. And after a few seconds of pushing on their chest, they shock the patient's heart, and they suddenly wake up and are back to normal. Well, that hardly ever happens. For young, healthy people, CPR can be life-saving and can restore a similar quality of life. However, for older people or those with other medical conditions, it rarely works. For those that do survive, quality of life and the ability to complete daily tasks is often reduced. And rib bones are usually broken. Other organs are often damaged, and they will usually be unconscious on life support with a breathing machine for several days.
So you can see that it doesn't really hold back. It's a very pleasant way of communicating this information.
Yeah,
But
I think the data is something like 20, it's only 20, it only works 20% of the time or something. And
yeah,
you are, the better you are. Or, and maybe you've got the data here actually.
yeah, exactly. And so patients are able to learn a little bit more on, what it is, why is it good, why is it bad, some simpler language. It because David put in his age when he signed up for this, it actually gives his personal CPR survival statistics. Um, and it sources everything. And so for a person in his age range, the survival rate is closer to about 15% without having significant effects onto your quality of life. But you can also explore what it looks like for people in other age ranges. And at best, if you're under 60 and healthy, it's closer to 28%. So I think there's a lot of misinformation about CPR that's out there. And what we find is that
Vinnie
our
Jones
patients
comes and does it for you. You know Vinnie Jones?
exactly.
The English hard player, soccer man, and part-time actor. He has a video on how to do CPR to the tune of Staying Alive. Boom.
Yeah, exactly. And I want to be clear, we don't discourage CPR. We just want people to make an informed decision on their quality of life and what's important to them. So if you are, 94 and it's important for you to have a certain quality of life and to be at home with your loved ones and your pets, maybe CPR in multiple contexts is not what you opt for, but maybe it is. So if we go to this next section, we are able to identify both in your current state of health. So perhaps right now you're healthy, you run 5 miles a day. I certainly don't. You can choose the kind of care you want in your current state of health. So let's say I would want it only if my treatment team thought it was appropriate. And you can also choose what it looks like if your condition is irreversible. So you're not getting better, things are escalating. There's really no way to reverse the clock a little bit. And in that situation, if your quality of life, as you've defined it in that previous section, is violated, would you want it? And you can see here that there's some options that are grayed out. And that's because this patient has selected various things in their living scenarios, or perhaps their quality of life preferences that go against or would suggest that you shouldn't pick this option because of the quality of life preferences you selected. But let's say I've clicked it anyway. It explains why that option is grayed out. You can talk to one of our advocates to explore that topic a little more and maybe change your mind or change your perspectives on your quality of life. So there's lots of different options to explore it as well. So the other options or the other scenarios or care scenarios that we explore are mechanical ventilation, dialysis, and feeding tubes. But for the sake of time, because many patients take a fair amount of time to explore this with their families, with their loved ones, or just take time to think for themselves, others know exactly what they want and they breeze through it. For the sake of this, I will log into my own personal account because I am very open with my preferences.
And how long did it take you to do yours? I'm interested.
So it took me probably about a half hour.
Yeah.
I breathe this every day. And so for me, I already had a pretty good idea of what I wanted. The part that took me a little longer was deciding who my medical power of attorney was going to be, because I didn't necessarily want my parents involved. I don't want them to carry that weight and that responsibility. And I wanted to create a good dynamic between them and my husband in terms of the decisions that they would have to make, or my husband would have to make. So that's the part that took longest for me. So let me show you my plan that I recently created. Once you've created or gone through all of the different sections, you can actually go back and edit any preferences you have or any preferences you want, really, and change your opinion anytime you want, really. Once you've created your or gone through the whole platform, the next step is to share your care plan. And we encourage sharing your plan with your loved ones or the medical power of attorney you selected, because they need to know what the heck they're getting into, right? They need to know what choices you've made. You want to be able to start that conversation with them. Nobody likes being surprised 5 minutes before they have to make a major decision. It's just really, really important that you share a plan. So this is really easy to do. You're able to view your unsigned healthcare directive. Here's mine. It's got the whole gamut of choices that I've recently inputted. You're able to share it directly with your loved one with messages pre-created, and anyone else you might want, whether they are a different provider or a different loved one. And you can look at your email history of folks you've shared it with as well. So let's skip this for now because I don't want to spam my husband. And the next step is you can sign your plan immediately on the platform. So every state has different signing requirements. We are live and legal in all 50 states in both English and Spanish. In the state of Texas, where I live, you can e-sign your document, you can virtually notarize it, or you can take a paper copy and go to a notary public. And we have all of these options available here. So patients are able to e-sign them directly on our platform, schedule a call with a virtual notary that will pop up on their schedule. We actually have an integration coming up in the next couple of months where as soon as you press this virtual notary button, a virtual notary will pop up and you can sign it immediately on the platform. And what's great is once that document is completed and signed, the most up-to-date version is visible in the electronic medical record. So the patient doesn't have to remember to bring anything back.
So let's talk about that part of the integration. So that's great. You've got the whole plan ready to go. All those decisions made. Let's talk about that part because that's where it seems to me that a lot of times this thing breaks down. Even though there's been legislation and much more conversation and thought about this over the last sort of 15, 20, 30 years. What actually happens, at the bedside is still often a mess. And as you mentioned, many people don't have an advance directive of any kind when they get there. So there's a difficult conversation with the family right at the bedside with doctors having to deal with this. And even if they do have one, there was a famous study, it's getting dated now a bit, but I think back at the Brigham and Women's where 50% plus of the advance directives were ignored. I believe that was so there's a lot of them. So what happens now and what have you had to do at Koda Health to introduce, to actually integrate with the medical records of the clients you're working with?
Yeah, so there's two things. The first is we are EMR integrated. So physicians are able to pull up a patient's directives and look at who their medical power of attorney is. I can give you a quick view of what that looks like.
Yeah, please do.
Let's do that. So a patient is able, or a provider is able to pull up our advanced care planning dashboard. They're able to look at the patient's name, who their healthcare agent is, what the relationship is, their contact information immediately right then and there.
So this is a tab in Epic Hyperspace.
Yes,
there
exactly.
anyway, right? What is normally this tab empty? I know, in the absence of you being around,
or it's an uploaded PDF. It's not great, right? So you're able to in our version we have our instance of Koda that pulls up and is easy to navigate. You're able to view their most recent advanced directive. So in this state or in this situation, this person has moved to Texas, so they've completed their care plan for Texas, and they've revoked their care plan for Louisiana because they no longer live in that state. So they're able to see how their preferences have changed as well. And they're also able to pull up that exact document and go through it and see what that patient's plans are. The important part here, and I know this is where a lot of folks get tripped up. You're right. People ignore advanced directives all the time, right? People, and that's because physicians are also people. And when a patient comes in to the hospital or the ER with their brother, their loved one, their wife, they are not going to go pull up a legal document in the electronic medical record and say, hold on, Mrs. Smith, I have to read this document real quick, and then read the document. That doesn't happen, right? They're going to turn to the person that's with them, or they're going to turn to that loved one, whomever that is, and ask them, what do you want me to do? Right? Because that's the human thing to do, which is why it's so important to share your care plan with your family and identify who that medical power of attorney is and have that in the system, right? Because they can quickly call that medical power of attorney and ask them, what do you want me to do? Or if that person is in the room or is related to someone who's in the room, you can ask them what to do. And we actually ended up getting a couple of different awards, both research awards and various AI and aging prizes on our research and work on family medical power of attorney patient alignment. Because I think a lot of providers think that all of this process is within their control. And in reality, more of it is in the patient and the family member's control than we as providers might imagine.
So, I mean, that's super important. And I think you're right. So let's talk a little bit away from the product towards the company. So how, when you came up with the idea and you started building this out, obviously you looked there, we need to get integrated with the EMRs. You mentioned health plans before. How are you going about taking this to large healthcare organizations and saying, hey, here's a problem I can help you fix? And what's the actual process of that sort of integration? How does it actually work? What are the conversations you have to have, both sort of business-wise and also technically?
Well, the conversations are long, as anyone who has worked within digital health, serving B2B and enterprise sales will attest. The conversations are lengthy, right? And for good reason. You want to evaluate a vendor. You're bringing them on to serve hundreds of thousands, if not millions of patients. You have to do a thorough security review. We as a vendor have had to do countless security reviews. We're SOC 2 compliant, all of that. And then there's implementation checklists, making sure you have the right people connected at the right places, all to be able to do a successful launch and go live. So the conversations for us, I will say, in terms of sales, are not difficult. This is a known problem. It is a known pain point. And the incentives are all aligned. Patients want this, family members want this, providers want this. Providers do not want to have these really stressful conversations in the hospital, in these emergent scenarios. Health systems and payers want this because a patient with a plan, no matter what that plan says, is significantly cheaper to manage. And they're able to avoid, readmission penalties and unnecessary admissions and all of these negative things by addressing this root operational and emotional issue, right? So the sales narrative is not hard. Actually pushing through and making sure you're removing as many barriers as possible for the patient, the clinician, and for the health system or payer that is paying for this is the critical part.
And how does that work? How does it work for a payer as a customer versus a provider? I get the provider because they can offer it to their patients perhaps on intake, but they may not have such a strong relationship with the patient. A payer probably have much wider relationships with more people, but may not have the ability, may not have the actual direct input into the provider EMR. So if I'm getting this through a payer, does it not go? Do I just get this as a consumer only tool and then up to me to send it to my doctor? And how do you make that work kind of at the coalface of when someone shows up in the emergency room?
Yeah. So when we work with payers, which is probably half of our clients, they deploy Koda as a member benefit. So patients are able to, whether through single sign-on and through various benefits packages, create their advanced care plan, make their decision. In that share page, you saw that they're able to share with whomever they want, whether that's as many providers that are involved with their care as they want. They can share that with them, and we can actually fax or e-fax at that point those plans into their EMR, but we're not integrated into every EMR in the country. That's not possible, right? But again, it boils down to where the value truly is. And although when we work with health systems and payers, we do EMR integrate, we think it's important. The most important thing is that family alignment, having plans in the first place, right? When less than 7% of patients have anything, having something is already a huge step of the way towards, putting a dent in this issue, right? And patients are able to share those plans. They are able to communicate with their family members, and we can get most of the way there.
And is all your distribution currently via providers and plans, or do you have a consumer accessible version as well? How do you think about growing your business?
We are currently B2B2C, so we want to remove as many barriers to patients as possible. Patients are able to access this for free. It's part of our through their health system or payer, right? It's part of our major narrative is that we're able to serve patients with equal rates of engagement across race, gender, and socioeconomic status because we go through their providers and their payers, right? As we grow, we'll be expanding a little bit into the direct-to-consumer side, but really just to help patients who are leaving their provider or leaving their payer continue to have control over their care. As we grow, our big growth strategy, because we are a venture-backed company, we are growing pretty quickly, is to actually expand into other difficult conversations that drive value to both patient and to the health system at large. So helping patients make decisions on various treatments like kidney care or cancer care, going into more sensitive areas like pediatric advanced care planning, things that very few folks have tackled that require this combination of humanity and technology to get the job done.
Okay, so decision making, shared decision making as a whole is going to be a big part of your future. Let's talk
Correct.
about the current. You mentioned venture backing growth. How much money have you raised, and where are you on those growth metrics? How many systems are you covering? How many plans are you with? How many people are you covered? Just give me a sense about where you are.
Yeah, so we are approaching our Series A. We've raised about 6 million in the past to build this company, to create our competitive moat, to deploy all of that. In terms of where we are as a company, this year we have well over 750,000 patients under contract. Next year, I think we're going to have somewhere between 1.3 and 1.6 that we're starting off with under contract. So we're growing pretty quickly. We have clients in basically every single model of healthcare. We have clients in the value-based care provider space, in the payer space, fee for service. There's a very clear value prop across all of those different divisions, for lack of a better phrase right now. And so, yeah, we're growing pretty fast.
Fantastic. And how long has this been on the market?
About 2 years.
Okay, so not that long. So you're a relatively new company with a different approach to a pretty old problem.
Yeah. And we've been around for about 4 years. It took us a little while to build it.
Yeah, that's the thing I remind all when I'm working with early stage companies or people building a plan, is that you got to include the couple of years where you've got to build the thing that's going to take over the world first before you can go and sell it. Well, there are a few people in this business who do sell things that aren't built, but it tends to catch up with you.
Well, then you lose your shot, right? There's only so many clients in the space, right? And if you shoot your shot too early, you're forever going to be marked.
It tends to catch up with you in the end. That's fantastic. All right. I've been talking with Tatiana Fofanova. She is the CEO of Koda Health, which is in the advanced care planning, advanced care management state. Did I get the term right?
Serious illness, advanced care planning, shared decision
advanced care planning stage, and
sure.
soon to be other kinds of care planning as well.
Yeah.
Tatiana, thanks for your time.
Thank you.